So we hear it all the time. People are really crippled by medical debt. We're going to do a whole show today on that topic with our guest expert, and it's going to be super interesting. And even if this hasn't happened to you, I hope it hasn't, you want to prepare yourself for how to avoid all kinds of pitfalls within the medical healthcare system. So stay tuned. Your relationship with money matters. I'm Michelle Perkins, and this is the Money and You podcast, where I will be breaking down your relationship with money, offering tough love money tips, and a money dating plan that will focus on lifting the barriers to success to help pave the way for better money practices and increased wealth. It's time to take control to live a limit-free life. It starts today. Hello, hello. Welcome to the Money and You show. I'm Michelle Perkins, your host, and so glad to be here with you today. I have a great show, and I don't know if you listened a few weeks ago. I did a show on the surprising facts of aging, which I was learning myself, and so I promised more, about the costs of aging as well as the costs of medical help. So today I'm bringing you just that, and I'm going to introduce our guest today, Bob Hertz, who is a happily retired healthcare insurance agent in Minnesota. For years, he got to know and dislike many aspects of his own industry. Now he wants to make sure that people are not financially harmed by the healthcare industrial complex. Welcome, Bob.
Thank you, Michelle. Nice to be here.
It's great to have you here. We had a great chat earlier, and I'm super excited for you to talk about many things, including medical debt and just your wealth of knowledge on this topic. I also love the fact that you are here, frankly, out of the goodness of your heart. You're not even currently working, so you're not trying to actually introduce any products or services of your own, and so I think that makes you a unique and special guest. So can you give us a little background and what brought you to doing these kinds of podcasts?
Of course. I consider myself a Garrison Keillor Democrat. And by that, I mean there's a Minnesota tradition of the politics of kindness, you might say, or another way to phrase it is the golden rule. We should treat others the way we would like to be treated. And that you never know in this life when you're going to be the one who needs help. And so you ought to maintain help institutions that help others. The medical debt interested me. Thank God I haven't had to experience much myself, but I watched others receive it, be burdened by it. And then I encountered a story about 4 years ago. Bernie Sanders had an event, and a man came up to him, and the man said, "Bernie, I'm in trouble with medical debt." And Bernie said, "How much debt do you have?" The man said, $139,000. And Bernie said, "Well, how can you pay it?" And the man said, "I can't pay it. I think I'm going to kill myself."
Oh, goodness.
And it just appalled me that in this very rich country that we have let people be hurt by medical debt. So I've been studying ways that I could have helped that man and can help others.
Wow, that's a compelling story. Thank you so much. And there is had my many experiences with Minnesotans, and yes, there is a definite vein of kindness, I think, that runs through a lot of them. And thank you for sharing that. Can you give us, I know we're going to go through some tips on how to best handle things like medical debt. How are you seeing that people get into this predicament mostly? I mean, I know there are many, many ways, but are there a few common themes?
Yes, there are. It's very important to know if you're going in for a procedure, if you have a relative going in for a procedure, that there are two phases of medical debt. The first phase is after the care, you receive a bill from the provider, the doctor, the clinic, the hospital, the blood testing lab, wherever the care was done. Where people really get into trouble in medical debt is if they ignore that first bill. And, emotionally, I can understand that. If they had a tough surgery, that's the last thing they want to do. And if they don't have a spouse who's with them every step of the way, or a child, if they are elderly, they may be intimidated by that bill. But if they don't communicate with the provider, they can get into trouble. The provider is the easiest place to get relief. Once a bill leaves the provider, in other words, if the provider says, this guy ain't going to pay, they're not talking to me, I'm tired of bugging them, the bill can go to a collection agency. And these people are not the nicest people in the world. They make their living browbeating people into paying old bills. And sometimes they even break the law to do it. I don't mean it's not the mafia. They're not going to break your other leg that you just had fixed. But they are the ones who harm you the most. Mm-hmm. So think of those two phases.
Yeah, I totally agree with you. It's like that, and people don't understand that you can talk to people about your financial issues, whether that's with your credit card or medical debt. And I think that's a great point. When you call a provider's office, they, not 100% of the time, but oftentimes they will work with you. They'll work out their own payment plan with you sometimes. I'm
That's
just
right.
thinking, because I've managed my husband's dental practices, and I know when people would call and tell you their story, we would try to help them out in some way. And you're right, that communication, knowing that somebody is at least, acknowledging the bill and thinking about it and trying to work it out, that makes a world of difference to the provider. So that's really great advice. And I wanted to just bring up something before I forget it. For a long time, medical debt would impact your credit. And what I've heard is that it no longer does, but I actually do not know.
It's a complicated issue. Let me
Yes,
speak to that?
Please.
Very important issue, because as your show demonstrates, if you have serious damage to your credit, it will cost you money for years and years. Higher mortgage, maybe no mortgage offer, higher rent, maybe you can't even rent if the credit is bad enough. So it can damage everything you do financially. Here's an important fact to know. The healthcare providers very rarely report you to the credit agencies. It is the collection agents that report you. Stay within the provider, communicate. And as long as you're making an effort and in discussion, or as you say, maybe in a payment plan, the provider will not report you. If it gets to a collection agency, they will report you. And your options become more limited.
Mm-hmm. Yeah, and it's not just service providers. I know we've had a problem with an ambulance company that really created some havoc with, and it was actually an ambulance ride that the person did not want.
Oh my, yes.
That's another interesting thing that happens. There are a lot of, little service providers along the way, both before and after the actual medical providers. Do you want to speak to that at all?
Well, that's right. What people need to know is that there are sources, not always easily accessed, but they're out there. There are sources to get help before you get way over your head, before you're referred to a collection agency. I'll give you a couple examples. Hospitals are, at least nonprofit hospitals, which is most of them, are legally required to offer some sort of financial assistance to people who are up to 4 times the poverty limit. Now, for a family of 4, That's $83,000 of income per year. That's a lot of people.
Wow.
But a lot of people don't know that, and it isn't easy to apply. You have to get your tax returns, pay stubs. You might have to prove your assets. It's like any other government program. It's a pain in the neck to apply, but they can reduce your bill. Also, there was a new law put out about a year ago, a little more than a year ago, called the No Surprises Act. And that covers a niche of situations where you're admitted to a hospital or an ambulance is called for you. You had no ability to deal with this surprise, and perhaps they are overbilling you. So people can challenge those bills. Finally, if you need to take an expensive drug, the drug companies sometimes offer you financial assistance because they want to build up their stable of people who are using the drug. Mm. So I'm backing up what you're saying, Michelle, that people will negotiate until you get to the collection agencies, and then they don't negotiate.
Yeah, super interesting. I had no idea that you could get that kind of help, either from the hospitals or from the drug companies. And I'm sure there's a lot of bureaucracy that goes into it. But if, it is better to investigate that and try to take advantage of it than be left with all kinds of medical debt later on. So, yeah, interesting. So let's talk about, health insurance a little bit.
Yes.
What that provide. I'll tell you, my son got, a real job with real health benefits, and he sent me the company's list of options for the health insurance and asked me, what should I do? And I looked at it all, and I know a few things here and there, but
it's almost unreadable.
It's almost unreadable, and in the end, there's pluses and minuses, and you feel like I could just throw a dart at this thing because, I cannot actually make a really great decision. So there you go.
It is very difficult. Here's the advice, and again, I was an insurance agent and worked with small groups and individuals, and so I would tell them that there are two basic choices. There are a lot of little individual niches and details in the policy, but two basic choices. Choice number one is high premium, low deductible. If you pay the high premium offer, and not every company gives you an offer, but not every employer gives you an offer, but many do. And the Affordable Care Act, if you don't have an employer, gives you lots of offers, almost too many. But the first choice is high premium, low deductible. You I'll pick a number, $600 a month, and your deductible is $500 or $1,000. Now that $600 is going to hurt you. Mm-hmm. It's going to be painful every month. But if you are hospitalized, there's not that much pain financially.
Right.
Your second choice, basic choice, is low premium, high deductible. So that might say you pay $300 a month. And if you're hospitalized, you pay the first $4,000 yourself. That's your copayment or your deductible. The terms are almost interchangeable. That's your out of pocket. And so the $300 doesn't hurt you as much. But if you are hospitalized or need serious medical tests, there is more pain. And a lot of people, the Bernie Sanders group, which I have great sympathy for, though I'm not a card carrying member, mm-hmm. but I sympathy a lot, they think these are lousy choices. Mm-hmm. They would like us to all pay higher taxes and have $100 deductible or no deductible. Mm-hmm. But that's not going to happen tomorrow. Mm-hmm. So the good people listen to your show should keep those two choices in mind. Now, how should you choose? Well, if you're 30 years old and the most dangerous thing you do is ride a motorcycle, and you don't have to ride a motorcycle, maybe you choose the low premium, high deductible. If you're 58 years old and there's a history of diabetes or heart disease in your family, maybe you haven't got it yet, but you could. you might say, I'm going to pay that higher premium because I'd rather have that extra hurt of $300 a month than a big hurt of $5,000 or $10,000.
Right. Yeah, it makes me think. I have a giant deductible, and not a low premium, but we have very few offerings for private insurance, and that's when you're an entrepreneur. And I know we have a lot of entrepreneurs listening. Your options become very limited. Um, so that's interesting to think about, though. Yeah,
Well,
thank you. It's
that's good. The other way to deal with it, which is sort of easier said than done, because I didn't always do it in my own financial planning. So I can't say, don't follow me. Don't do what I do. Do what I suggest. And that is, if you get to be 50, 55, and you're not in a corporate environment where you might be well protected against these things, um, you should start setting up some type of health savings account that you don't touch. Because if you start it uh, before you're sick, and you can put away 100, 200, 300 a month in that account, then when you get a health event, you've got some extra money to help cover it.
Oh my gosh, that's so funny that you brought that up. I was just going to bring up the same, with the same caveat that while I've had the opportunity to do this and my health insurance is set up with, I actually paid for a health insurance plan that has an option to do a health savings account. And I've had it for several years, and every year put it on my to-do list to set that up, and have not yet done it. So,
Uh-huh.
a little embarrassing to even say, but since you said it, I'll say it. And but it's a very, very good option. Not only do you get the savings benefits, but you get tax benefits for that as well.
Yes.
Yeah. Yeah, that's a great tip. These are interesting things to kind of think about and plan for. Um, what else? What else are some of the, if you, I guess for the people to both avoid medical debt, like you said, to talk to providers, and any other tips you have, I'd welcome them. And then also for the people who find themselves already there.
If Let's talk about those who are already there because their problem is the most urgent. Um, Things to keep in mind. The I'm going to reiterate something I said earlier in the broadcast, but when people are facing a huge expense, they must hear this again and again, which is communicate, communicate, communicate. Hospitals rarely, but in some states, that they'll sue people,
Mm-hmm.
and collection agencies will sue you at the drop of a hat. The people they sue almost invariably have ignored all the letters because it was too painful to deal with, and they're mad. They're mad at what this country has done to them, perhaps, but they're mad and they don't communicate. And so the hospital says, well, we're going to sue you. That's the only way to get your attention. And the court will make you pay something. Another thing to remember, if you're really stuck and deep in debt, is look around, and you have to be kind of computer literate to do this. But maybe if you're not computer literate, you have a son or daughter who is. I mean, 8-year-olds are better than I am as, at the computer these days. But have someone help you look for advocates. These are people, sometimes they have a fee. I've done that work for a fee. Sometimes they do it out of generosity, but they are advocates and they will help you deal with hospitals if you find it, or your mother or father finds it too difficult to deal with them. Also, contact a very interesting organization that I support, and I helped get it off the ground in whatever way I could, called RIP Medical Debt. They buy medical debt from collectors and forgive it. And they can't do it on order. They do it in big groups. But there are people who will buy your medical debt for 10, 15 cents on the dollar and then forgive it.
Wow.
There's also a group I just read about the other day called Soul Suit, SOLESUIT. In this group, and they assist you for very low cost to draft a letter that could even be presented to courts on your behalf. And at the very end, they'll have an attorney review the letter so that if you feel you have a case, if you feel you've been cheated, if the bill is excessive by any standard, you can countersue or counter complain and get into court yourself. The one thing you can't do, as I've said before now, is to wait back for it to go away.
Wow, very interesting. I love to hear that there are groups that are showing up and trying to figure out some innovative ways to help people in this situation. Yeah, very interesting. Thank you. And, as you were talking, I was thinking one thing you said made me think to myself, medical bills are not always correct. That's the other thing. We have to be very vigilant about what we're paying and make sure we understand it and that it's accurate. To me, it's always a little confusing because you get a bill and then later there's insurance that was applied and it's a new bill with a different amount. And so you never quite know when you're at that point when the bill is sort of final and all the insurance payments have been made. You want to give a little guidance on that one?
Yes, one thing that happens should never happen, but in this world of paperwork flying back and forth, it can easily happen. Is that it happened to me? That's why I know. Is that the insurance company? I'm sorry, that the provider forgets to send the bill to the insurance company. Mm-hmm. I had a case. Thank goodness, it was only about $300, but every dollar counts. I got a bill for $300 for a medical test, which I have every 3 months due to a condition I have. And I'd never gotten a bill before that. I'm on Medicare, incidentally. So I called my Medicare company and said, why did I get this bill for $300? Whereas for the past 5 years, it's always been paid. And they said, well, we don't know. They said, let's do a conference call. And so we got on the phone with the provider, and the provider said, oh, I'm new here. I didn't know about this provision in Bob's policy. So I sent Bob the bill. And so the medical insurance company, Blue Cross of Minnesota, were just great. They said in kind of what's the word? A peremptory tone that I was delighted to hear. They said, well, listen, Bob doesn't owe this bill and I want you to take it off his record. And by God, 2 days later, the bill was gone. So that's the first thing to check is, did the bill ever get to your insurance company?
Mm-hmm, mm-hmm. Yeah, very interesting. And sometimes the way the bills are put together, it's a little hard to understand. So again, to your point, go back and communicate, ask the questions. Like I do feel like people, for whatever reason, are intimidated to, or maybe it's not intimidation, it's whatever it is, but they don't get on the phone and make these calls. Maybe it's because you might be on hold for an hour with Blue Cross Blue Shield, but still, it's really important to investigate and ask the questions. The other thing I found, and I used to find helping out in the dental practice too, that not everybody knows the same things when you call. So you might call one time and you get somebody who tells you one story, and then you call back and you get a different person, and that person is more knowledgeable or more helpful, and you get more information and sometimes a better outcome. So
that's true. And it helps a little bit if you have some knowledge. You don't need a detailed knowledge, and you'd have to go to school for a year to get the knowledge, but you have some knowledge of how a medical bill is created. The basic method of creation is that the doctors and nurses during the day write down what they did. Gave a shot, checked for diabetes, did a skin test, did a blood pressure test, and so on. And that creates a code. There are, I think, 4,500 codes in the Medicare billing book, which is probably the most comprehensive. And each code, has a dollar amount to it. And so the medical provider might say, well, you had a broken arm, and these are the typical 12 codes that go with a broken arm. So we're going to bill you for each one of them. And then you read the code, you read the output, and you say, I never had a blood test like that.
Mm-hmm.
Or I never had 3 x-rays, I had 1. And so that gives you something to talk to the provider about. And you should, because it's bad enough to have trouble paying for your care, but if the codes are wrong,
Yeah.
then it's really a problem.
Oh, I love that you just explained that to people. I just realized that, I when you already understand that, you sort of visualize the bill, and you understand how it came to be. But if you don't, it's such good information for people to have. That's a great tip for people, like to understand how those bills are generated. So, yeah, great insight there. Okay, so what else? What are some of the things that people, when they, another thing I found is that people don't necessarily understand their own insurance. I'm sure I don't understand my medical insurance either, and the details of it. And what do you find are some of the things where people maybe make some mistakes that might hurt them financially out of a lack of understanding?
That's a very good question. The main mistake people make, the 2 main mistakes. One is something that I totally understand, but it has to be said. It has to be said more than once. And that is, ask what it's going to cost. I have had wonderful doctors all my life. I really didn't need one between about age 15 and 60, but I've had, several since then. Every one of them has been just a great person. I have much affection for all of them. But there are times before I got involved in this work, I wouldn't ask what it's going to cost.
Right.
Like, that's an insult. This is a man or woman who's he's a healer. It's like they're like a priest, they're like a nurse. They're like a priest or a rabbi. And in many ways they are. But the good ones don't mind being asked. They're not offended. So that's the first thing. Ask what it's going to cost. The second thing is, both in that phase and in the bill phase, document everything. If you call the provider or the insurance company, and the insurance rep says, well, I think that this code should have been covered, you ask, what is your name? It's Bill Jones or Mary Smith. And you take a note and you say, on April 24th at 2 p.m., Mary Jones said that this test should have been covered. And because if it ever gets to it, you've got some good ammunition.
Mm-hmm.
If you come back a month later and say, well, you told me it was going to be covered, and they'll say, who told you?
Mm-hmm. Mm-hmm. Yeah, that's excellent.
That's true. It's not just true in medicine, but because many of us are intimidated, in a nice way by doctors, we won't ask.
Mm-hmm. Yeah, there is. I don't know how it is for people who are younger than me, but yeah, we kind of came along where there was this interesting respect for the profession in a way that you didn't talk money. Another money relationship kind of.
Oh no.
Strange
And
thing.
if you watch medical shows, and I'm talking, if you go way back to, like, you're from Hollywood land. If you go way back to Dr. Kildare or Ben Casey, that's a little before my time, and you move up to House, or there was a show just about emergency rooms. Was it called Emergency? There was a great show.
Yeah, I think there was an ER one. Yeah.
And of course the House series. Ask yourself, how many times did people talk about money in those shows? Never.
No. Everything's life or death, and money shouldn't be thought about. But then later on, unfortunately, we have to think about it. So, yeah. Okay, so before we run out of time here, I want to just ask you, I know you had additional tips that you like to share with people with respect to medical debt. Would you like to go through a few more of those?
Some more advice of how to deal with it?
Yeah. Or how to
Yes,
avoid it, either way.
that's right. Yes, here's a specific piece of advice. Some providers, and it should be noted that the providers don't like insurance companies any more than you do.
Yeah, that's a fact.
They get declines by insurance companies. They get runarounds by insurance companies. They get, underpaid in some cases by insurance companies. They don't like them either. But they, just a minute, I lost my train of thought. I apologize. Just a moment. I'm sorry.
That's okay.
The providers. Oh, yes, finally. Thank you. Thanks for your patience, Michelle. I'm really sorry. I apologize to your listeners.
Trust me, I understand.
Some providers, and they need money too. I mean, they're not poor, but it costs a lot of money to run a clinic.
That's right.
We learned that during the pandemic, when going for appointments was discouraged for a while in 2020, and clinics and hospitals laid people off. They don't have $1 million in the bank.
Yeah.
So they need the money. And so some of them will say, if you say, well, gosh, this bill is a lot, it's $10,000. I don't have the money in cash. They'll say, well, we have a medical credit card and you can charge it on the medical credit card and you'll only pay 9% interest. What's not often said is that if you miss any payments, your 9% interest could become 29% interest. And if you can't make that minimum payment, it goes right to the credit bureau. So the bottom line is, it's better to set up a payment plan with the provider. And you might have to sign a brief legal agreement saying, I will pay $350 a month until this is paid off, rather than pay it all off and think you've solved it with a credit card, but the interest will kill you financially. And so I recommend against using the medical credit cards.
Oh, another great point. Yes, a lot of people, I know Care Credit is one of them, and at least that's used in the dental world, but I'm pretty sure it's used for medical things as well. I used to explain that to people because there was a maybe 6 to 12 months that you could have 0% interest, which would be very enticing. But same thing, if you missed a payment, then that all reverts back to, it's a whatever the current interest rate is. And so, but people wouldn't necessarily know that, and they don't make it super clear. So that was a great point. Yeah. Yeah.
And so it's a large struggle, and we're starting to see some legislation to improve things. There's one piece of legislation which I'd like to see, and unfortunately I haven't seen anybody sponsor it, is this. In Medicare, there's a provision that if you go into the doctor and the doctor files a claim with Medicare, and for some reason the claim is denied, maybe Medicare thought it was excessive. Medicare does deny claims. It's not a perfect world.
Right.
It's not claims heaven. Medicare does deny claims on occasion. But if a Medicare claim is denied, you, the patient, usually have no liability. Your provider has to argue it out with Medicare. In the under 65 market, that's not the case. If the insurance company denies the claim, the doctor can come after you. So I'd like to see a very simple piece of legislation which extended the Medicare protection to people under 65.
Yeah. Yeah, very, very interesting. And insurance is complicated, and it is really working for themselves more than anyone else. So, it's what really to summarize everything. What I'm taking away is pretty much what I always take away, which is you have to educate yourself. You have to go into these things understanding the system, understanding your own insurance, understanding your money, understanding, how to communicate with these people. I really thank you for coming on and talking about this, because
Well, thank you very much.
it's an area that people tend to not educate themselves around. I think they go into it, me included, with just sort of a hope that you'll be more taken care of than.
Yes, and as we've said, it's an area that can spoil all the rest of your financial planning.
Mm-hmm, exactly. Yeah, we hear about that all the time. It was a medical debt issue that basically ruined a person financially, and so it can happen. It does happen. It's not something we just read about once in a while, and it's not really out there. So thank you for bringing it to people's attention so they can,
Thanks, Michelle.
again, spend a little more time on that. I'm a big proponent of people paying attention to their money and spending some time understanding these things, not when you need to, but in advance. So, Bob, can you tell people how they can contact you or
Yes,
learn more?
I have a blog called The Anti-Debt Agenda, and all the words are bunched together. The Anti-Debt Agenda, and that has my contact information. I'm glad to hear from anyone, and if I can, I might. I'm not an advocate, but I can refer you to advocates.
Wonderful. Yes, that whole advocate idea is a fantastic one. I honestly am an advocate for my parents right now, and it makes me sad every day to think about the people who don't have an advocate, because I don't know how they would do it, honestly. Well, thank you again, Bob. I'm so appreciate
Thank you, Michelle.
talking to us today. That was a lot of great information, and it also sparks a lot of additional questions. So I hope people will get in touch with you, or take advantage of that offer to get a referral for advocates and read your blog. And I'll put the blog link in the show notes. And have a wonderful day, and thank you.
Thank you very much.
Okay, and listeners, thank you for being here. We love having you listen to the Money and You show. Please give us a like, a review, whatever feels right to you. And if you want to learn more about your money, I'm having a new Your Money Date program, which allows you to go on 10 money dates with me as your chaperone while you learn more about your money and how to set up dates and what to do on them. So that you can learn all about, your personal finance, everything from budgets to debt to savings to earnings, a series of topics that are super interesting. And we can go on that journey together starting May 16th. So if you or someone you know might need that, reach out to me, Michelle@limitfreelife.com, and I can give you more information. So you can find the show on all the podcast platforms. Share it with your friends. We are here to really help you understand, get to know, and take action with your personal finance. Okay, have a great week.